Hello, all, and welcome back. So, today the topic for discussion is about the granulocyte collection and transfusion. So, I have Dr. Anand with me, and together we will be discussing the common FAQs related to the granulocyte transfusion collection. And we will also be showing you how to do an apheresis collection for the granulocytes. So, Dr. Anand, could you just brief me as to what are the granulocytes and why are they needed for transfusions, or what subset of patients require them for transfusion purpose?
So welcome everyone and thank you for the question, ma'am. Granulocytes are a group of WBCs that contains granules in their cytoplasm, which include neutrophil, eosinophil, and basophils. And those patients with severe neutropenia after a refractory infection, aplastic anemia, bone marrow failure syndromes, those who received hematopoietic stem cell transplantation, and those patients with congenital and acute neutrophil dysfunction are those group of patients which are often benefited through granulocyte transfusion.
Right. So, what are the donor selection criteria for collecting granulocytes by apheresis method?
Granulocyte apheresis is a process of collecting granulocytes from a prospective allogenic use donor using an apheresis cell separator for transfusion to a recipient. For donor selection, the donor must be AB and RH compatible with that of the patient. RHD negative granulocyte should be preferred for an RHD negative female in their childbearing age. Irradiation is mandatory to prevent transfusion associated graft versus host disease, and all donors must be screened for infections like hepatitis B, hepatitis C, HIV, syphilis, and malaria. And donors with medical conditions that would contraindicate the use of corticosteroids, GCSF, that is a granulocyte colony stimulating factor, and as well as exposure to erythrocyte sedimenting agents like hydroxyethyl starch, HES, should be avoided for granulocyte collection. And also, donors should not be fasting prior to the procedure, and informed written consent should be taken from the donor prior to the procedure, and also donor should be hemodynamically stable to undergo the granulocyte collection procedure.
So, yes, and apart from this, all other routine criteria for a donor selection for apheresis remains the same as for the like we do in platelets or plasma collections. So, they will all remain the same for the granulocytes as well. So, now can you just tell me a little bit more in detail about the stimulation of the donors before the granulocyte collection?
So coming next to granulocyte stimulation. Granulocyte stimulation ensures adequate number and quality of granulocytes for transfusion. Stimulating agents used are corticosteroids with or without GCSF. Donor stimulation with properly timed corticosteroids is usually given 12 hours before the procedure, increases the number of circulating granulocytes by releasing those that were adhering to the vascular walls. Use of GCSF in combination with corticosteroids increases the granulocyte count as much as 14-fold times compared to the granulocyte count of an unstimulated donor. Typical GCSF stimulation protocol includes administering 300 to 480 microgram of GCSF subcutaneously and 8 milligram of dexamethasone orally approximately 12 hours before beginning the procedure.
So, what are the side effects of donor stimulation for granulocyte collection, and how often do you face it, and how do you resolve it?
So, ma'am, following donor stimulation using GCSF and dexamethasone, we have seen most of the donors face minor discomfort like myalgia, headache, and generalized body pain, and most of them are rapidly relieved with NSAIDs. And however, we haven't seen any significant or long-term lasting side effects following donor stimulation.
Right, so how do you calculate the final dose of the entire product which has to be transfused, and what is the average yield which you target in your procedures?
For collection of the granulocytes, it is usually done using automated apheresis collection devices such as spectroptia, and final yield of the collected product is calculated using the formula absolute neutrophil count of the product into product volume into 1000. Average dose of granulocytes per transfusion for pediatric age group is 6 to 8 to 10 power 8 granulocytes per kilogram of the recipient body weight, whereas for an adult of 70 kilogram, it corresponds to 1 to 2 into 10 power 10 granulocytes per transfusion.
So what is the quality control of the apheresis granulocyte product, and what is the shelf life of this component?
These are the QC guidelines recommended by DGHS for granulocyte concentrate, which is prepared from apheresis method. The volume should be 200 to 400 ml. The granulocyte count should be 1 into 10 power 10 per unit at minimum. Other leukocytes can be 0.1 to 0.7 into 10 power 10. The platelet count should be 2 to 10 into 10 power 11, and the red cells should be within 5 to 50 ml of the total volume. And it should be stored at 20 to 24 degrees Celsius without agitation, and the shelf life is maximum for 24 hours, but it is recommended to transfuse as soon as possible after the collection.
So in settings where we don't have apheresis facility, or the donors don't consent for mobilization, or the donors are not available, so what alternatives can be used instead of the apheresis granulocytes?
So in such conditions where the apheresis facility is not available or if donors are not available, pooled granulocyte concentrates can be used as an alternative, which is prepared by pooling 5 to 8 units of Buffy coats, which is prepared from the whole blood transfusion. The negative of it or the disadvantage is that the granulocyte yield is comparatively lower in these pooled units when compared to that of the apheresis unit, and also it requires pooling of multiple donor units, which increases the complexity, and there is a risk of contamination and multiple donor exposure also.
So having discussed about the background of the apheresis granulocyte collection, now let's move on as to how do we collect the procedure, and we'll take you through the procedures, the steps as to how we mix the HES, the anticoagulants which are used in the procedure, and how do we target the yield and collect the procedure. So Dr. Anand will be showing you as to how it is being done. And in case of any queries, you can always revert back to us, or you can put on your questions in the comment section. So thank you.
So now we will be demonstrating the granulocyte collection procedure based on this scenario. Here we have a case where the granulocyte collection was planned for a 11-year-old female diagnosed with sickle cell disease who has undergone stem cell transplant also. The donor was her own father, and the patient blood group was O positive and body weight was 14 kilogram. As mentioned before, we had done a pre-procedure assessment with initial clinical assessment of the donor. Venous access was also done. CBC and serology report of the donor was also taken. Donor serum was cross-matched with the recipient for compatibility, and also pre-medication with granulocyte colony stimulating factor GCSF and dexamethasone was also given. So here in picture, we have the various requirements for the procedure. We have the 6% HEA solution, which we are using as the sedimenting agent. We also have the Spectra Optia ideal kit, which is used for granulocyte collection. And also we have the trisodium citrate, which is being used as an anticoagulant. So here in the initial step of the procedure, we are approximately mixing about 40 ml of trisodium citrate separating from these bottles with the HCS solution, hydroxyethyl star solution, which is a 6% solution, to make it a 6 citrate based anticoagulant. As prompted in the machine, remove the coils, nab the cassettes and hang the bags, insert the channel and close the door. These are the various steps of kit loading. These steps are similar to that of the kit loading plasma exchange procedure which we have covered detail in our previous videos. Meanwhile, we have to also enter the donor details like gender of the donor, height of the donor, weight, and also the recent hematocrit of the donor. Next, for priming the circuit, we have to initially spike the HCA solution to which the trisodium citrate was added. Followed by, we will have to spike 500 ml of normal saline also, which is used to prime the circuit of the tubing set. So after completing the priming process, both the inlet line, which is red in color, and the return line, which is blue in color, are both connected to the patient through different vascular access. Here, since the donor was having a poor vascular access, we have placed cannula on both the hands to maintain a secured vascular access. Once the granulocyte collection procedure has started, we have to manually adjust and establish the initial interface. Here we can see in the screen that the diamonds have started appearing in the interface area, but they are not aligned with the line. So we have to adjust the interface value. Usually the interface value is placed near to 2 or 3 values above or below the recent hematocrit of the patient, so that good quality and proper yield of granulocyte is obtained during the collection. Another important step is to match the color of the product with that of the collection preference tool, which is provided with the machine. For granulocyte collection, the collection is always done on the darker side, and the color is matched with the left most pattern that is provided in the preference tool, collection preference tool. Here we can see that the collection preference is getting established slowly. The diamonds also have started aligning with the collection preference that we have set manually. Also, the color matching is also proper with reference to the collection preference tool. Once both the color matching and the collection preference is established, we can start to collect the product into the bag. We can select the option and press apply button. Based on the CBC values and WBC count of the donor prior to the procedure, a mid-count sample has to be taken after attaining certain volume of the granulocytes during the procedure. So for taking the mid-count sample, the product which has been already been collected in the bag should be mixed gently and thoroughly in both directions so that the product is mixed properly. After mixing the contents properly, the clamp to the sampling bulb is opened. The bulb is squeezed gently so that about 2 ml of the granulocyte product is collected inside. It is then reclamped and the sample bulb in which the sample was collected is detached from the collection bag using the sealer. The granulocyte product in the sampling bulb is later transferred to a EDTA vial and the CBC counts are done from the sample. So in this particular case, the mid-count sample was taken at 55 ml of collection. The values were that the total leukocyte count was 1,47,000, percentage neutrophil was 86.6 percentage, which correspond to an absolute neutrophil count of 1,27,300. So at a product volume of 110 ml, which was already obtained during the procedure, the yield was calculated using the formula absolute neutrophil count into product volume into 1000 divided by body weight. Since it was a case of a pediatric patient, the yield we obtained was 9.93 into 10 power 8 granulocyte cells per kilogram. So as per the mid-count values obtained, the procedure was planned to conclude at 110 ml of the total product. Since we have taken 2 ml of the granulocyte product that was already collected for doing the mid-count, in the machine, the total product volume is set at 112 ml, so that the product that we receive in the collection bag at the end of procedure will be 110 ml. So these are the run target values that has been attained. Total run time was around 47 ml. The whole blood processed was 1753 ml, which correspond to around 0.4 TBV of the donor, and 112 ml of the granulocyte product was also collected. After that, we had proceeded to rinse back. On proceeding to rinse back, the clamp of the inlet line is clamped. Then the saline roller clamp on the inlet line is also opened. Also, the collection bag which has the granulocyte product is also sealed and detached from the machine. Continuing with the procedure of rinse back, the blood in the tubing set is flushed with saline and the blood is returned back to the donor.